lower back MET technique approach. So this is useful for hip flexors, QL, longissimus, yeah, pretty much anything here, and also a little bit of glutes. But the main focus we're gonna do is this way. So I don't know if you remember, Swedish way is there and you kind of like just wiggle it around. I find it's very ineffective. What you want to do is a little bit of butter, and then from there just butter up a little bit the lower body, okay? But from there, either the elbow grip or the knuckles or the fist grip. So you have the first grip here, and I'm leaning in with my body, okay? My arm is straight, I'm not shrugging, and I'm hitting everything with the lower body. And if you notice, I'm leaning in, my arms is straight, I'm not muscling through it, and I'm leaning in and going all the way to the sacrum and deviate from there, working a little bit the glutes. So that's the first grip. So remember, karate chop, grip, or elbow, okay? For this, you go for accuracy over everything. So from there, you get some depth in, you go slowly, okay? Very slowly. You are on the edge of the spine, and you go all the way to the sacrum, okay? So that was all good and nice for this, but if you want to really get directly the QL when the person is laying down, I personally find the two knuckle approach is the best, okay? So roughly starts at L1 and then finishes sacral iliac for the QL, very often problematic muscle. So you go from there and you're gonna press down, not too much, until you find boop, you're falling. So from there, this is where you can access the QL and also all the jumble mumble there. Boom, here two knuckles, there. And once you feel that the longissimus is ending, and you can get it really like the lateral side of all the lumbar muscle, you keep your arm straight, lean in gently because it's a very sensitive area. And then from there, I have my hand over, pushing and mobilizing the fascia that is on top. So boom, shoop, getting the depth, mobilizing the fascia on top, locking it in. And then from there, I'm leaning with my body, and then my hands, now they have to do a little bit of work. This hand on top here is moving forward towards her head, and the other hand under, which I'm gonna show, is moving all the way to the sacrum, or can go all the way and more deeper and get a little bit of hip flexors from there, especially at that angle, okay? So the hand on top is also moving upwards. So from there, shoop, going down, getting that depth, locking that in, and then from there slowly move. And it's a very sensitive area, so be gentle and take your time. Now it's a little bit too quick to my taste, but usually I would go and the whole move would take 2-3 minutes from L1 all the way to the sacrum. This is the version with the knuckles, very deep and precise, where you can also use your knuckles and just scoop that in. It's not as deep, but it's more general, and you're kind of like brushing the muscle fiber of the lower back up and down to prepare it for deeper work and getting more precise, especially the trigger points there.